We have a lot of patients that come to us and say that my cataract surgery has failed. And why? Because they have the symptoms of burning, itching, irritation, heaviness in the lid, watering, or some sort of discomfort which doesn't feel completely normal after surgery. Now, is this considered a failure of cataract surgery? Why does this happen? And what exactly is happening behind the scenes is what we are going to discuss in this video today. Now, cataract surgery has evolved from a very large incision and sutures to a very tiny incision. However, it is known that there is dryness that happens after cataract surgery. So, these symptoms are not, let me make it very clear for you, that these are not considered to be a reason for failure of cataract surgery, though they are giving you the discomfort. Now, why does dryness happen after cataract surgery? There are 4 reasons. Number 1, even though the surgery is very advanced and we are making very small cuts, still they are enough to disrupt certain amount of nerves which are triggering the secretion of tears. Number 2, diabetes and pre-existing dry eyes. So there are various causes of dry eyes that we have seen in the videos earlier. In addition to that, diabetes is extremely common in patients who are undergoing cataract surgery. So when these two are pre-existing, that means they exist even before a surgery, they can get exaggerated in manifestation after the cataract surgery. Number 3, the medicines that you use after a cataract surgery always contain preservatives. Now, preservatives are necessary to keep the drops well enough so that you're using it for a long time, but they do some amount of disruption to the tear film and the ocular surface, causing these kind of symptoms. Number 4, there is inflammation after cataract surgery. So, the inflammation also plays a role in changing the tear dynamics and the surface and making you feel a bit uncomfortable. So, is it a failure of surgery? No. It is a common side effect of cataract surgery. Like after a LASIK or a SMILE, there is nerve disruption and there is dryness. Similarly, the studies published in PLOS ONE 2013 and a recent study in 2025 has seen that almost 90 to 100% of the patients who have undergone the modern cataract surgery also have some amount of tear imbalance. The intensity may vary from person to person, but almost 90 to 100% across the world have got some amount of tear imbalance. The symptoms of tear imbalance are dryness, burning, itching, irritation, heaviness, and sometimes even watering. Now, in all this, there is a small condition which is usually ignored, which is called as conjunctivochalasis. Now, conjunctivochalasis is basically a loose layer which is covering the eyeball. This usually manifests with age, like we develop wrinkles on the skin, there is these folds which develop on the conjunctiva. Now, these folds are sitting on top of your lower eyelid. Now, these folds are resting on the lower eyelid. These cause irritation. It feels like there is something that is constantly there in your eye, and also cause watery looking eyes. Water does not flow out, but seems like the eyes are full of water, where people may even ask you that if you're crying. So, conjunctivochalasis is something very common in old age, usually ignored, not treated, and that can also be a cause for these symptoms after your cataract surgery. So, what do you do in these conditions? The first and the best method to go about is before cataract surgery, evaluate if you are having any form of dry eye. Now, how that will help is help you prepare for what is going to come ahead. Number 2 is after cataract surgery, the studies have shown that it takes about 12 weeks, which is 3 months, for the whole tear film and the dynamics to come back to normal. Now, till 3 months, you can continue to keep using lubricants and follow certain healthy eye practices which your doctor may recommend to make yourself feel comfortable. If the dry eye continues to exist after 3 months, then also you can go back for a detailed evaluation of your dryness to see if there was anything else other than just a cataract surgery induced dryness in the eye. You can ask your doctor if your symptoms are too high. You can speak to your doctor and change to probably a preservative free kind of medications to reduce certain amount of symptoms. If that loose conjunctiva is the one that is actually bothering you, you can also undergo another surgery to basically cut and remove that excess folds which are causing these symptoms. Now, since this concept is very complex, I would recommend to not jump into conclusions and label your surgery as a failure. Get yourself thoroughly evaluated for the complete ocular surface and dry eye and see what else can be done to make you feel better. Now, if you think this information was useful and helpful, share it with someone who needs it. and follow us for more such eye health related content.